morning students. In today's lecture we will discuss about icterus. In local term it is called as jaundice. So, jaundice is one of the metabolic disorder in biochemistry which results in various manifestations in the human body. So, first we will be discussing about the brief metabolism of hemoglobin, followed by the metabolism of bilirubin, and then how the jaundice is manifested in our body, and then what are the clinical signs and symptoms, how do we diagnose this, and what are the types of jaundice, and what are its remedial measures and the treatment available for that. Okay. So, now let us get into the lecture. The title is icterus. So, icterus is the medical term which is used to describe jaundice. So, in the common language we call it as jaundice, in Tamil we call it as manjakamalai, where it is a metabolic disorder where there is a yellow discoloration of skin. So, the 2 points that you need to remember regarding this topic is, this is a metabolic disorder, it is not a disease. Second thing is, there is a yellow discoloration of skin that we know, that is in jaundice the sclera of the eye and the fingertips and where the soft tissues are present in the body, all of them will look yellow, and we all know that the urine also will be yellow in color. That is called as the yellow discoloration which will take place in the jaundice condition. So, this is the definition and introduction to the topic. The medical term is icterus. Sometimes this icterus in the small babies, neonates, we call it as neonates, just born babies or premature babies, sometimes this goes and affects the brain, we call that term as kernicterus. Kernicterus. So, kernicterus is nothing but jaundice affecting the small babies, just born babies, we call it as neonates or premature babies, that is called as kernicterus. So, this is the definition to the jaundice. Now, we will see how this jaundice occurs in our human body. We know that we will briefly see the metabolism of hemoglobin. We know that this is liver, human liver, and we have spleen here, this is human spleen. In the spleen, RBC, that is red blood corpuscles, red blood cells are destroyed after 120 days. The lifespan of RBC is 120 days. After 120 days, the RBC is destroyed in the spleen by a system called as reticuloendothelial system. Reticuloendothelial system is a meshwork of cells which will trap the RBC. RBC after 120 days will not be able to pass through the reticuloendothelial system, and they will be trapped in the reticuloendothelial system. So, after that the splenic macrophages are called as phagocytes, which the cells which will destroy the RBC. So, once the RBC is destroyed, all the cell components will be digested, leaving behind the hemoglobin. We only concerned about the hemoglobin in the jaundice. So, we focus only on hemoglobin, we do not focus on any other aspect of the RBC. Hemoglobin will be broken down into two parts, one is called as heme, another is called as globin. This heme is the non-protein part of the hemoglobin and globin is the protein part of the hemoglobin. Globin will be broken down, I will just extend this, globin will be broken down to amino acids. This amino acids will be used by the body for the synthesis of new proteins in different parts. This heme is now broken down by, it will be acted upon by two enzymes, bilirubin reductase, and finally it forms bilirubin. Initially it forms biliviridin and then it will be acted upon by the enzyme bilirubin reductase and it forms bilirubin. This bilirubin is a yellow color pigment and it is toxic to the human body. So, it has to be excreted from the human body. So, what does the body will do? Body will transport this bilirubin to liver via splenic artery. This will be splenic artery which will transport the bilirubin to the liver. So, in the artery in the blood, this is combined with albumin, a protein which acts as a carrier. I will put B for bilirubin. Albumin is a transport carrier protein which will carry the bilirubin in the blood and it will go and reach the liver. We know that liver is called as the chemical factory of the human body, where different types of metabolism takes place in the system. Now, here this toxic compound bilirubin will be detoxified to bilirubin monoglucuronide and further to bilirubin diglucuronide, glucuronide by UDP glucuronyl transferase enzyme, which will transfer this glucuronide part to the bilirubin, and initially it will be converted to the mono derivative and then later on it will be converted to the substituted derivative by this mechanism. Due to lack of space, I am not writing the details of the reaction here, I am just giving you the schematic representation of the reaction, metabolic reaction taking place in the liver. Now, this is called as this diglucuronide, BDG, bilirubin diglucuronide. Bilirubin diglucuronide is called as the conjugated bilirubin, because it is conjugated, it is combined with the glucuronide, a compound, that is why it is called as conjugated bilirubin. This bilirubin, which is not attached to any compound, is called as unconjugated bilirubin. Okay, I will just put it here as unconjugated bilirubin. Okay, we will come to that later. Now, there is a part in the liver, this part we call this as the gallbladder. In Tamil we call it as Pittapai, where there is a Pitta neer will be there, that is bile juice. This contains bile juice, I write it as BJ. BJ is bile juice, which will be green in color. Now, this bilirubin diglucuronide will enter into the bile juice, it will enter into the bile juice. Now, during the digestion, we will now we will shift our focus to digestion. Now, what happens during digestion whenever we eat any food? This is the mouth, then you have the esophagus. Okay, I am not a good drawer, so excuse my drawing. You understand the drawing what I am drawing here. This is mouth, this is called as the esophagus, that is food pipe. Food pipe, the food comes into this. In the stomach, proteins will be digested. In the mouth, carbohydrates will be digested, and then you have the duodenum. This part is called as duodenum, that is small intestine. Small intestine starts here. The semi-digested food that comes out of this duodenum is called as chyme. Chyme is the partially digested food that comes out of the stomach here. And then you have the intestine, you know that it just goes like a many folding like this, and finally this is a small intestine and this will be your large intestine. So, I am just putting it for schematic purpose, we are not very much interested in the diagram part of the story, we just see the what happens in the case of jaundice. Now, in the duodenum, this bile juice, the semi-digested food chyme, this contains fat. Fat is not digested here. Here carbohydrates are digested in the mouth by saliva, in the stomach proteins are digested, and then the partially digested food chyme comes out of the stomach and enters into the duodenum, where fat has to be metabolized. Now, this fat, you know, it is hydrophobic in nature. What do you mean by hydrophobic? Hydrophobic means it does not dissolve in water. You know that whenever you put oil in water, oil does not dissolve in water. Okay, we call that as hydrophobic. This fat is hydrophobic. All the metabolic reactions in our body takes place only in aqueous solution, namely it takes place only when there is water is present. 75% of the body is made up of water. So, all the reaction takes place only in water. So, unless this fat dissolves in water, it cannot be metabolized in our human system. So, how to make this fat to be soluble in water? For that purpose, we have the bile juice. So, this bile juice, now it is secreted by this liver, gallbladder, now it enters into the, this enters into the duodenum. Bile juice enters into the duodenum. We put a separate line here in the duodenum, This line is called as the bile duct. This line is called as bile duct. So, through this bile duct, bile will be, I will remove this, you will come, it will come through this. Okay. So, this is not to be confused with anatomical portion. In the actual body, it will not be like this, it will be in a different pipe. So, for understanding, I am drawing it like this. Now, the gallbladder will secrete the bile juice, it will come through the bile duct and it will enter into the duodenum. Now, the duodenum, I told you, it contains the chyme, which is semi-digested food. The fat is present. This bile will come and it will cause emulsification of fat. I will just rub this, emulsification of fat. What do you call that as emulsification of fat? Now, this emulsification of fat will make the fat soluble in water. Once the fat is emulsified here, fat will be dissolved in water. Once the fat is dissolved in water, here we have another part, I will just try to use a different color. Now, you have another part here, this is called as pancreas. You have all heard of pancreas, which is responsible for secretion of insulin in our body, which is associated with the diabetes mellitus. Now, this pancreas will secrete pancreatic juice into the duodenum. Pancreatic juice, I write PJ. Here it is BJ, that is bile juice. Here it is PJ, that is pancreatic juice. Now, it is secreted into the duodenum. This pancreatic juice contains an enzyme called as lipase. Lipase means it will act on lipids. Lipids means fat. So, now, after the emulsification of fat by the bile juice, fat is soluble in water. Once the fat is solubilized in water, this lipase will act on the lipids, it will break down the lipids, metabolize the lipids and it will form various types of lipids, namely phospholipids, cholesterol, cholesterol ester, triglycerides, fatty acids, etc. So, all the fat that is present in our food is broken down into, depending upon what type of fat we have taken as our food. We might have taken some fried items, we might have taken some butter, ghee, cheese. So, depending upon the type of the fat that we have taken, all these compounds will be produced here and this will go inside and it will be absorbed. So, this is a normal metabolism. Now, what happens here is, suppose if there is a block here, if there is a block, this block can be due to a stone. That stone is called as the gall stone. In Tamil we call it as pittakal. So, if there is a stone formation in the bile duct, what will happen? The bile juice will not be able to come here. It will come here and it will stop. It cannot flow beyond this point. So, bile juice cannot come here. Therefore, fat cannot be metabolized. Therefore, fat will come out like this. Now, what happens to the bile juice? Bile juice will go back. It cannot move further, it will go back and now there is no way it can go. It can go to wherever it finds a way, it will go and get deposited there. Now, this bile juice which contains this compound, that is bilirubin diglucuronide, the detoxified bilirubin that is present in the bile juice will now go back and gets deposited in the all these soft tissues. All these soft tissues like sclera of the eye. I told you in the beginning of my lecture, in the sclera of the eye, கண்ணுக்கு கீழே இங்க இருக்கிற இந்த இடத்துல, then in the tip of the nail buds and in some tender skins and all this will go and get deposited in all these places and it will cause a yellow coloration of the body. It will not take place in 1 day or 2 days, it will take some 4-5 days, 6-7 days depending upon how big is the stone that is formed in the bile duct. How big is the stone that is formed in the bile duct? Depending upon that, if the stone is very big, then no bile juice can cross this point and therefore, all the bile juice will which contain this bilirubin diglucuronide will go and get deposited causing yellow discoloration in 3-4 days. Suppose if the stone is very small, then little bit of bile juice can leak and go into this. So, the yellow discoloration will take some more time, 5 days or 10 days like that. That is why jaundice cannot be immediately identified as soon as it comes. It will take some time for that to be noticed in a symptomatic way. So, now this yellow discoloration has happened. This is called as the jaundice, that this yellow discoloration I told you is called as jaundice. Now, this jaundice is arising due to what is the reason for this jaundice? Due to this stone, that is due to the obstruction to the flow of bile juice. Bile juice is not able to flow, it is causing an obstruction. So, we call this type of jaundice as a obstructive jaundice. We call this as obstructive jaundice. Now, we will see types of jaundice. What are the types of jaundice? Types of jaundice, first type is obstructive jaundice. Obstructive jaundice. So, what is obstructive jaundice? Obstruction to the flow of bile juice to the duodenum by a stone. It can be due to stone. Common reason is due to stone. Sometimes there may be some tumor. There may be some tumor formed in the liver part or in the intestine part or somewhere. If the tumor is going to press the bile duct will be compressed and bile will not be able to flow. That is a very rare situation. Common reason is the stone formation in the bile duct, which causes obstructive jaundice. Now, what happens in the obstructive jaundice? There is no problem in the RBC metabolism, no problem. Bilirubin formation, no problem. Bilirubin transport, no problem. Bilirubin converted to bilirubin diglycuronide, no problem. Then it is not able to come out of this. So, bilirubin diglycuronide level will increase in the body. The level of this compound will be increased in the body. When you do the test, in the laboratory for the checking the jaundice, you can see that bilirubin diglycuronide level will be increased. You will be having increased conjugated bilirubin will be increased. This is a symptom. So, when you do the test, if you go to the doctor, if a patient goes to the doctor and says, "Sir, doctor, I am having yellow color urine," then the doctor will check the eye, will check the skin and he will give you for the blood test. Once he gives the blood test, he will see that this compound level will be high. Then he will suspect. That means there is no problem here, there is no problem here, there is only problem here. That means he will ask for, do you have a pain here or do you have pain here? Then he will do some physical exercises. He will make you to identify, then he will confirm you have a stone. The treatment for this stone is, there are two types of treatment. One, if the stone is very small or mild, it can be dissolved by using drugs or some changing food. We have lot of food in the Ayurveda and other type of alternative medicines. We have, they say Kiranelli Kira, Manatakali Kira, like that. There are many herbs. If you can take that regularly, the stone will be dissolved and the problem will go. But if the stone is very big, severe pain means surgery is the treatment, they will remove the stone by surgery. So, these are the two common treatments by this. Okay. Now, suppose if the bile juice BDG comes here, bilirubin diglycuronide, it comes to the duodenum and then it will be absorbed in the intestine, along with the food it will be absorbed in the blood. It will come to the intestine. It will come to the intestine. In the intestine, what will happen is, it will be converted into two compounds. One is called as stercobilinogen. Another one is called as urobilinogen. Two types of compounds are formed in the intestine. Now, this stercobilinogen will be excreted in the, we say, stools or feces. Feces is the thing which we excrete after we take the food. This urobilinogen will be taken back, absorbed, and it will be transported to kidney. It will come to kidney. In the kidney, it will be excreted via urine. So, in the urine, urobilinogen will be excreted. In the feces, stercobilinogen will be excreted. This stercobilinogen, once it comes to the feces, when it is exposed to the air, stercobilinogen will be converted to another compound called as stercobilin. This will give the color to the feces. Every day the feces color will be different. Suppose if you eat beetroot, the color will be different. Suppose if you eat greens, keera ella sapte, the color will be different. So, depending upon the type of food that you eat, the color of the feces will change, and that change is mainly brought about by this compound. Okay. Similarly, in the urobilinogen, which will be transported back through enterohepatic circulation, comes to the kidney, and in the kidney this will be converted to urobilin. I will write it here, urobilin. Urobilinogen will be converted to urobilin. This urobilin will give color to the urine. Suppose you have jaundice, means you have yellow urine, you have white urine. So, like that the color of the urine will slightly change depending upon the food that you take. Suppose if you do not drink water, it will be very dark yellow. Suppose if you take some B complex vitamin, then also it will be yellow. If there is any damage to the kidney, mild, there will be leakage of blood, that time it will be red in color. So, the color of the urine will give you an indication about your problem. So, this urobilin is responsible for the coloration of the urine. So, now since there is a obstruction I told you here, bilirubin diglycerol is not able to come here, stercobilinogen will not be formed, urobilinogen will not be formed. So, in the laboratory when they do the test for this and stercobilinogen and urobilinogen, all these level will be very much less. So, the doctor will confirm no stercobilinogen, no urobilinogen, very high level of conjugated bilirubin, he will say you have stone. So, based on this lab report, he will be giving stone. If you go to Siddha medicine, they will give you, or Ayurveda medicine, they will give you some medicines and they will ask you to restrict your food. Tamil la vandu pattiyo irukkiradhu appdin solluvaanga. Idu saapidadinga, adu saapidadinga. So, what they will say, enna item saapidadingo, don't eat oil foods, don't eat food contains oil. Why they are telling that? Because you can see that due to obstruction, bile does not flow here. If the bile does not flow, fat will not be digested. Fat will not be digested means there is no point in eating fat. If you eat more and more fat, body will be put to lot of stress. That is why when they give treatment for dissolving the stone, they will advise you not to eat fat containing food. They will ask you to stop that till the treatment is over, and once this is dissolved, till such time. Now, this fat will, if you eat fat, then fat will not be metabolized, it will be excreted, it will come out in the feces, it will come out in the feces. That situation, fat in feces, this is called as steatorrhea. Steatorrhea is a condition in which, I will write it here, steatorrhea. This urea means excretion, diarrhea, amenorrhea, steatorrhea, that means something is excreted from the body by its own mechanism. Since the bile juice is not secreted in the duodenum, fat will not be digested, therefore, fat will come out in the feces. That condition is called as steatorrhea. So, in the laboratory they will also do the stool test sometimes. So, in the stool test they will check for fat. If the fat is present in the stool, it is confirmed that fat is not digested, therefore, bile juice is not there, therefore, you can confirm that stone is present in the bile duct, and diagnosis will be made on that, treatment will be followed on that. Either you go to allopathy treatment, or you go to Ayurveda treatment or Siddha treatment, accordingly the treatment will go based on this. So, this is the first type of jaundice. Now, we will go to second type of jaundice. Second type of jaundice is neonatal jaundice. There are many types of jaundice, we will see how many we can cover today. Neonatal jaundice. Neonatal jaundice means, neonates means just born baby, newborn babies. Newborn babies will have jaundice. So, how do they have jaundice? Okay. So, this metabolism, this you have to remember this metabolism, okay. Then I will tell you what are the changes in the neonatal metabolism. Everything is same, everything is same. Now, we have to identify where is the problem. Why does the bilirubin level increase means jaundice, bilirubin diglycerol level increase means jaundice. Now, one condition where this is increased we have seen. Now, we will see this condition what is increased. So, here in neonatal jaundice what happens is, suppose if the mother, this is mother and this is father, you have father. Suppose if mother has got negative blood group, O negative, A negative, B negative, AB negative, like that, and if the father has got a positive blood group, A positive, B positive, O positive, like that. Now, this negative and positive, what does it mean? It means that RBC contains a protein. It contains a protein called as RH protein, rhesus factor protein. If the protein is present, it is positive. If the protein is absent, we call it as negative. That is the difference, fundamental difference between the two blood groups, negative blood group and positive blood group. And this positive is a dominant trait. What do you mean by dominant trait? That means if these two people marry, the child will be positive. That is why it is called as dominant. Okay? Now, when these two people marry, there is every possibility that the child will be positive. Suppose if the child is positive, a lot of combinations will take place, the child will become positive. Inside the mother's uterus, the child is there which will have this protein, whereas mother does not have that protein. Now, what happens is mother immune system, every day the blood of the mother go to the fetus every day, go and give the food and come back. Whenever they visit the fetus every day, suddenly one day it will see there is a new protein present in the fetus. Mother's immune system will start thinking, what is this protein? It will think that this is a foreign protein, some bacteria or some virus or something like that. It will think that RBC is a different cell. Therefore, mother's immune system will start attacking this RBC of the child. Okay? The mother's immune system will become sensitized. It will become sensitized and it will start reacting to this. Most of the time, the first child, before the mother develops some resistance towards that, first child usually escapes. It will be born without any problem. Now the mother system is now ready to attack this cell. Now, when the second child is born, which is again positive, as soon as the child is formed inside the uterus, the mother's immune system, which is ready now, it will immediately go and attack the RBC of the child. It will cause destruction of the RBC. As soon as it is formed, it will be destructed. That means, RBC will not wait for 120 days. In 10 days, 5 days, 20 days, 25 days, 35 days, 45 days, whenever it finds, it will destroy the RBC. That means, more and more amount of RBC is destroyed. What will happen? More and more amount of hemoglobin will be produced, more and more amount of heme will be produced, more and more amount of bilirubin will be produced, more and more amount of bilirubin will be transported to the liver. Now, every part of the body has got some capacity, like every human being. A car means, if you have a 100 cc bike means its capacity is 100 cc. If you have a 1000 cc car means it is 1000 cc. It cannot do 10,000 cc work. In the same way, liver can handle only a very small amount of bilirubin every day. That is, it can maintain an approximately 2 milligram per 100 ml of blood every day. It can maintain only 2 milligram of bilirubin per 100 ml of blood every day. Beyond that, it cannot maintain. Suppose if you put lot and lot of bilirubin like this, liver will not be able to detoxify that extra bilirubin. Now, the bilirubin level will be very high, this will be very high, this will be very high, everything will be increased, all these will be increased. Liver will not be able to handle that. What will happen? Bile juice will be there, bile juice will be secreted, this stone will not be there, fat will be digested, this will be formed, this will be formed, it will come in the feces, it will come in the urine, all the levels will increase. Now, what will the doctor will do? Doctor will do the test. Now, you can see unconjugated bilirubin also increased, conjugated bilirubin also increased, stercobilinogen also increased, urobilinogen also increased, but no fat in the feces, no fat in the feces, because metabolism is normal, bile juice is secreted, metabolism is normal, no problem, but bilirubin level is high. Therefore, if you look at the child will be very dark yellow in color, very dark yellow in color. You can see the child will be very fair due to the yellow discoloration by this bilirubin. That is called as neonatal jaundice, just born baby jaundice. So, this is called as neonatal jaundice, that is arising due to the mismatching of the blood group of the parents between the mother and the father. In olden days, say some few hundred years back, there was no treatment for this. At that time, the Indian system of education, how they treated this was, they called this as Seva Dosham. Seva Dosham means the girls born in a particular star. In the 7th place, they call it as Mars, Angaraka Dosham, like that and all. We do not want to go into that. That those girls born on a particular day, particular planetary position, they all found to have a negative blood group. They all found to have negative blood group. Now, that is why they said, if your girl is Seva Dosham, that is negative blood group, you marry the girl with a boy with a negative blood group, that is same Dosham, same Seva Dosham. Otherwise, the dynasty will not grow. Vamsam vandu valaradu. Why they said that? Because child will be affected and it will be killed, no treatment. That is why they say like that. But nowadays people start interpreting it as superstition, moodanambika, this, that, and no. There is a solid scientific evidence between all these, whatever the belief that we have in our system. This is one such belief. This is recorded in the book written by Sushruta. Sushruta Samhita. This is a Sanskrit book written on Indian medicine. The author of this book is called as Sushruta. He is the father of Indian medicine. He has written about this problem and he has defined it as Rakta Dosha. That means some dosham in the blood. So, he identifies that dosham due to this. At that time there was no microscope, no laboratory test, no modern treatments were not there. So, he was able to identify that the problem is in the blood, therefore, the child is dying due to that. So, in olden days, some 50-100 years back and all, the family used to have 5 children, 10 children, 15 children, out of them 3 or 4 will die in between. It was very common. That was mainly due to, one of the reasons for those type of death is due to the neonatal jaundice, which was not called as neonatal jaundice at that time, it was called as some Seva Dosham, like that and all. But nowadays we have treatment for this, no problem. Suppose if the mother is negative and the father is positive, you have some antibodies that can be injected to the mother will become sensitized, you can save the child from any of the problem arising due to mother's immunity. In spite of that, suppose if the child is positive and the neonatal jaundice comes, when the child will be born, now they give it as phototherapy. Phototherapy, that is, they will keep the child in a UV lamp. In the UV lamp, they will tie the eyes and they will cover the private parts and then keep the child in the UV light. The UV light will destroy this compound present in the child body. This is also, it will be destroyed, this will also be destroyed. Then they will give more fluids, the child will keep passing urine, 1 day, 2 days. So, all bilirubin will come out in the urine, it will come out in the, it will be broken down in the body, metabolism will take place and it will come out in the urine as a urobilin, then the child will become normal, no problem. Now, in the modern days, we have treatment for neonatal jaundice, we have the treatment for this. But in the olden days, there were no treatment. Okay. So, this is the second type of jaundice that we discuss. Now, this second type of jaundice is also can arise due to, sometimes there may be premature liver, the child may be a premature baby, that is the child born out of 6 to 7.5 months, 6 to 7.5 months. So, when the child is born in 6 to 7.5 months, we call it as a premature baby. The premature baby will not have the liver developed, liver will not be fully developed in the premature baby. So, what happens when the bilirubin is formed here, when the bilirubin is formed here and it is transported to the liver, there is no liver or the liver is not fully formed. Therefore, bilirubin will not be detoxified in the, there is no liver, therefore, bilirubin will not be detoxified, therefore, bilirubin level will increase causing jaundice. That will also lead to the formation of jaundice in the just born babies. Due to premature babies, they will also have neonatal jaundice. So, there are 2 types of neonatal jaundice, one arising due to mismatch of blood group, Another arising due to premature babies. Premature babies, if the mother's uterus is not very strong, the pregnant mother is not healthy, suppose if she does not take proper food, proper care and medical care and attention, if it is not given to the mother, pregnant mother, then there is a probability the uterus will be weak. When the uterus is weak, if the uterus is not able to hold the child for a longer duration, sometimes the child will be delivered in a very shorter duration before the last trimester itself. So, at that time also we will have this neonatal jaundice. As we can see in the neonatal jaundice, unconjugated bilirubin level is increased, conjugated bilirubin level is increased, all these levels will be increased. Okay. So, I will just summarize in today's lecture what we have seen. In today's lecture we have seen about jaundice. What is jaundice? Jaundice is also called as icterus. It is a yellow discoloration of the skin. How does it arises? It arises due to the breakdown of RBC in the spleen. When the RBC breaks down, bilirubin is formed in the spleen, transported to liver, detoxified and excreted in the feces and the urine in the normal condition. Suppose if you have a obstruction in the bile duct, then bile juice will not be able to flow, then the bile juice will go back, it will get deposited in various parts of the body, namely the sclera of the eye and the skin, causing yellow discoloration, which we call it as jaundice. That is the first type of jaundice. So, in the obstructive jaundice, we have increased conjugated bilirubin level, decreased stercobilinogen and urobilinogen, which can identify that. The second type of jaundice we saw is the neonatal jaundice, that is attacking the child, just born babies. There are two categories under the neonatal jaundice. One is arising due to the mismatching of the blood group, another is due to the premature baby. Mismatching of blood group is nothing but the mother will have a negative blood group, father will have a positive blood group, then the child will get a jaundice. In the premature baby, liver will not be fully formed, otherwise everything is normal. The bilirubin produced in the body is not detoxified by the liver, therefore, the child will get jaundice. So, there are many other types of jaundice, we will see that in the forthcoming lectures. Okay? Thank you.